Hello, I'm Dr. Jennifer Linden, President CEO of Hazard Community and Technical College, and I'm here today to talk to you about successful youth apprenticeships using our K-Tech model. With me today is Dr. Sandra Cadu, Chief Academic Officer at HCTC. She's really been the brains behind this project, and I'm excited for her to speak with you today about it. But first, I'd like to talk to you a little bit more about our region that we serve. HCTC is in the heart of Central Appalachia, and we primarily serve 7 counties. We have 5 campuses that are distributed throughout those counties. These counties face many of the challenges that many of you do in Appalachia, and among those, we do have some of the lowest per capita income rates in the nation. We have other challenges as well. We have low educational attainment. Many do not have a high school diploma, let alone an associate's degree or a bachelor's degree. So that certainly is a challenge in our area. These statistics are the statistics for Perry County, which is the largest county that we serve. The county of Perry has around 30,000 in population, and the city within the county has around 5,000 people. So we're pretty rural. The other counties that we serve have even lower population numbers than what I just gave you. Some of our other challenges across the board in the counties that we serve are population decline. We're seeing tremendous outmigration into other areas of the state. We also are seeing a loss of coal mining jobs. We continue to see a decline in the coal industry. But many of these people do have multiple skills that can be easily transferred into other positions. However, there is that sense of lack of opportunity in the region, and we see that not only with those who are unemployed, but also among our high school students. They just really don't see that there are many jobs for them here in the area. However, on the flip side, we have our healthcare organizations who are begging for people. They are really needing nurses, people who are in x-ray, surgical technicians, physical therapists. So we need to try to figure out where is that balance in the middle. How can we make students aware of these healthcare pathways at an earlier age and make them also aware that they can attain these types of positions in their life with the proper education? So, to help with this, along comes K-Tech. K-Tech is a U.S. Department of Ed grant through the Office of Career and Technical Education. It really focuses on STEM apprenticeships for high school students. So we've really started with healthcare and healthcare positions, but after healthcare, we plan to expand into other areas such as manufacturing. We're really pleased that Kentucky is one of 5 states to receive this funding and that it started in Perry County in Central Appalachia with HCTC. And we've not only begun in Perry County, but we are also expanding out into Knott and Leslie counties. We currently have around 30 students who are in the K-Tech program. But I'm going to turn this over to Dr. Sandra Cadu, and she's going to give you some details about the program and how it all works. Dr. Cadu?
Thank you, Dr. Linden. So K-Tech, as Dr. Linden described, is a project that's funded from the U.S. Department of Education. They utilize Perkins funding or Perkins discretionary dollars so that we can demonstrate some of these projects. And the spirit of that grant application was really to expand the popular word is apprenticeship, or a work-based learning opportunity for students specific to the STEM fields, but really in a competency-based model. And the whole idea of the project and how the grant was written was to focus in areas that normally don't have work-based learning opportunities or apprenticeships, and to provide opportunities for high school students to be able to build on their rich curricular and extracurricular activities in high school, to build upon dual credit pathways that lead into post-secondary education, but then to add on a work-based learning opportunity. So we took our project as a 9 through 12 That's where we're focusing on. And we're looking at providing them a very clear pathway in terms of what their curriculum expectations are for both dual or concurrent enrollment classes, but also the classes that set those students up for success in the pathway. We've also added in some work-based mentoring. We've added in some career exploration for students to be able to identify if healthcare or whatever pathway we're building is something that they want to do. As Dr. Linden said, we're focused in healthcare, and really that's because this region has a shortage of healthcare workforce, but yet we have individuals who could work and stay in the region. We have a lot of high school students who leave for jobs, but really we have well-paying jobs in the area specific to healthcare. We've also begun to explore, and we've placed our first student in an IT occupation as well. And really, the whole project is based on what the employers are saying that they need. So what we have in terms of how we've built this is we've looked at some of our core elements, and this is this little graphic that I'm showing right now is something that I took out of one of the publications that we have, and it's really looking at long-term partnerships, and it's a partnership between the college, our K-12 partners, and our employers. And it's focused on where the jobs are, where those employers have a need for employment. There's a really strong mentoring and support program for this, because for many of these students, it might be their first job, and sometimes they need a little bit of help on how to be a good employee. It's a really innovative approach. I'm going to show you some examples of, because it is competency-based, we have to have those industry mentors ensuring that the students are gaining those skills when they're working and earning. We've also, like I said before, we've built in some job shadowing and some just career exploration into the front end of the program so that students can start in 9th grade and kind of do a little bit of exploration. The courses that they take in their first, then their 9th and 10th grade lead to multiple pathways, so they can do some exploration before they determine what they want to go into. Our employers initially have been ARH, which is our local hospital. It's a regional hospital, but our local hospital has been placing student workers. Primary care is a clinic in the area. We have partners with the University of Kentucky Healthcare. We're expanding out beyond these, but these were our initial partners. We're working initially within Perry County. So we have a Perry County Central High School, Hazard High School, and Buckhorn High School are also part of Perry County. And as I said before, as Dr. Linden said before, we're expanding out into Knott and Leslie County and into Breathitt County, and actually across the state, because there's other state partners that are working on this. So this next slide I'm going to show you is the pathways, a couple examples of pathways that we have developed. And what this is it provides the student what they need to do in 9th, 10th, 11th, and 12th grade, so that when they get to 11th or 12th grade, their junior and senior year of high school, we can work to place them in employment. And they have to apply for that. They interview, they get some extra support through that process, and we match the employers up with students, and the employers then select the students. And then this leads into either the students can continue to work, they could continue into an adult apprenticeship, or they can transition and take the dual credit that they have earned in high school into one of our programs in these high demand areas. So the ones that I'm showing you right now is a pharmacy tech, and that's an example of one where we have a shorter term credential in that, but we don't have a long-term program in that. And we've had some really good success, and I can tell you a story with our pharmacy tech with these students. And then the other one is medical assistant. We also do a nursing. We have a variety of healthcare ones in addition to IT. And I'll tell you the story in just a little bit about the pharmacy tech. But here's an example of just some of the materials that we have been put together to send out into the high schools. This grant is funding 2 full-time employees here at the college. The first is a project director, and then we have somebody who's working behind the scenes on the reporting, but more importantly, the framework for managing that competency-based experience. The project director works really closely with the employers who connects, and I always want to say he's like the matchmaker. He can recruit students and take the applications to the employers, and the employers then interview the students. He's providing a lot of mentorship, but the employer also provides mentorship. And the best story that I have with this is we had a student who was hired on as a pharmacy tech apprentice. And that student didn't understand, the need that they had to come into work every day. I know for you and I, that probably seems something that we know, but this student had never had that experience before, and had about 3 days of not showing up for their scheduled shift. And the employer reached out to our project director and said, what can we do? And the project director said, I can get you another student. And the employer said, nope, I'm not ready to give up on this individual student. Let's continue to work with them. So through that partnership, they were able to bring the student in, provide some strong mentorship, and that student became their best apprentice for that year. And that's the kind of stories that we like to share, because this is all about providing those opportunities for those students to be able to, they're working in their field that they might want to go into, or maybe it's they're going to explore and they're finding out that they don't want to do that. We had a student who was in pharmacy and then decided, I want to go into medicine instead. And so they changed their pathway based on their experiences in high school. And that way they're better prepared when they get to college, or they become employed with any of these healthcare partners. Our healthcare partners are thrilled with this work because we're helping fill the shortage that they're seeing in their pipeline. Another early win for us has been we do a lot of nurse aid training, and nurse aid is required to be at least on the registry, but our nursing program always likes to have nurses, the nursing students have experience as a nurse aid, and that's a really great thing that they can do while they're in nursing school. But there's a shortage of nurse aides around the area, and our hospital actually changed their entry-level age for employment for nurse aides just for this program from 18 to 16, so that we could allow these students to start working in that. And that was a big win, and that was a big win across the state. And I think that at the Department of Education, they still talk about that. And that was really a digging deep down to finding out why these students, why that age was set at 18. Some people thought it was the Kentucky Board of Nursing. Some people thought it was, the hospital, or, it was the, that's the urban legend. It's always going to be 18, but we dug down and we were able to get the hospital to for this specific program to change their age requirement, which was a big win. So we started placing a lot of nurse aid students working at the hospital, and it filled a gap. The one component of this is we do have this idea of this competency base. So we have checklists of competencies that these students need to learn how to do while they're out in their job. And then we have they're each assigned what's called a task mentor, and that task mentor is ensures that that student has gained those competencies, and that really supports the classroom instruction and takes that out into the live format. So a little bit about, kind of where we're at. Our first year, we had 50 students apply to this. We kind of had a little bit of a late start and had to put our materials together rather quickly. We placed 18 students in employment, and we had, if you count, it's a federal grant, so we have to count a lot of students a lot of different ways. We had several hundred students somewhere in the pipeline. So they were either in their first year, second year, third year, or fourth year. And we were able to start those students. We started the grant on year one, but we had some students that were ready because we already had some dual credit pathways developed. Year two, which was just this year, we had 75 students interested in, and we placed 30 students. And that's pretty remarkable because this was in the middle of the pandemic, but we were still able to have students working out in the field. We did add one IT apprentice, and that is at a healthcare setting, and we're working to expand that even further. The number of apprentices working at employers. As you can see, there was a little bit of a dip from this graph, and that is the start of the pandemic when, you know, we didn't know what was going on, and so we you know, and that was at towards the end of the year, and those students were, you know, finished with their apprenticeship, and then they and some of them were juniors and continued on. But you know, this batch of 24 and then 29 that we had in January, we just added another. Those are all, I think all of them are new students this year, so those are additional unduplicated students from the year before, which is really exciting to provide those opportunities. Some of the things that we've done with our funding is we've, you know, created these pathways. We have, and I call our project director, and I'll have his contact information at the end. I call our project director our bird dogger, because he's the person who's able to get out into the schools. He's talking to the teachers of the different classes. He's talking to guidance counselors. He's setting up in the school, and he's really recruiting. But then at the same time, he's working with the different employers to try to find out where they can build some additional pathways. We've been working on, you know, building those relationships, having conversations with parents, and really focused on placing students that are in underrepresented populations. One of the biggest fears that I had in the start of this grant was, how do we serve the students who maybe have a hard time with transportation and getting to work? You know, how can we provide those opportunities for that? And the UK Center on Rural Health, actually, we worked on developing our community healthcare worker pathway, where those students were actually bused right to the UK Center on Rural Health, and they had their classes there, and they were able to do their work-based learning components for a couple hours a week while, you know, during school hours. So the schools have been very flexible in helping us with these students, and those, a lot of the students that participated in that specific work-based learning experience, you know, were students that might have had transportation issues. So we've really been trying to think outside of the box to really focus on those underrepresented populations. I do have to say, though, that you know, it's been a phenomenal program for most students. I should say all students, and the employers as well. And everybody is, you know, wants to, you know, how can I help? I want to be able to mentor a student. And I didn't mention this before, but these are all paid. They're paid apprenticeships. So these students are getting paid. They're in high school. And I always give the example of, you know, what would you rather do? Would you rather, you know, work at a fast food restaurant, or do you want to work in something that you can think about? That's where you want to build your career. And so this is a great opportunity. I have a couple slides of some pictures of just some students and our employers and our partners as we were working through this. You know, just to, you know, we have our pharmacy tech students up in the corner. We provided them with some shirts and some things so that they could be walking advertisements for this program. And it's just, you know, like I said, it's been a great fit for Eastern Kentucky. And the next slide will be more pictures. And up in the upper right-hand corner, that is Tim Kugler. He is our project director. And like I said, he's been out in the communities really promoting this program and recruiting and trying to recruit new employers, new sites, new schools, and working with the students. We really lucked out with him. Here's another example. We decided, just because of the nature of where we live, another place to really advertise is at our sporting events, our local sporting events. So we have some, you know, some advertisement up at our football stadiums and our soccer fields and so on and so forth. What our next steps are, this is a 3-year project, and so we have another year left on the grant. And so we are, like I said, expanding into this IT pathway. We're also looking at additional counties in the area. We're serving as a model for the rest of the state in terms of building out our youth apprenticeship or work-based learning opportunities, and really developing a marketing strategy to continue this work, because it's really good work. But then beyond the grant, it's really thinking about, how do we sustain this? You know, we have the funding, you know, from the generous, you know, funding from the Department of Education, but once we get beyond this, how do we sustain this? So we're looking at a couple different models in terms of having the employers help in terms of funding the positions, because I firmly believe that you need somebody like Tim really driving and like I said, coordinating all of this behind the scenes. I'm leaving the contacts up here for KTEC specific to HCTC in this region. As I said, Tim Kugler is our project director. We also have a director of program facilitation, and she works, like I said, behind the scenes, working on setting up some of those accountability systems for reporting for the federal government, but then also managing that competency-based model, because there's a lot of behind the scenes for that. So with that, we can take questions.